It's a pleasure to be here this morning, and my topic is heat, extreme heat, and the health impact of extreme heat. Okay, so I have no commercial interest to declare, and heat is significant because currently it's the leading cause of mortality from extreme weather. If we look at this pie graph, you can see that heat is responsible for about a quarter of all of the mortality that's attributable to extreme weather, with hurricanes contributing another quarter, and then about 50% is made up of floods, tornadoes, winds, lightning, windstorms, cold, etc. And I want to stress that this will vary in different parts of the country. So I spoke in Massachusetts last year, and in Massachusetts, flooding was actually the chief cause of mortality from extreme weather, and so different states will vary. So what I'm going to talk about is how is the temperature changing in the U.S., what is an extreme heat event, who is vulnerable to heat events, what kinds of problems do heat events cause, and what can we do about them. And I want to mention that all of the presentations are to be posted on the PSR page for this meeting, and so all of these presentations will be available. Okay, so this is basically another look at what Dr. Patz presented earlier, which is that the anomalous extreme heat events around the world are increasing. The x-axis here is years. It starts at 1880, goes up to 2015, and the y-axis is the extent of the anomalous heat event. So that's degrees Fahrenheit. And it shows you that with each passing year, the number of anomalous events is increasing. This is around the globe. But what about for the United States? Well, let's take the last month as an example. In August, the average temperature for the continental U.S. was above average. The maximum temperatures were above average. The minimum, meaning the nighttime temperatures, were above average. But what about what people experience on the ground where they live? That reality varies. And in talking about climate change, it's really important for us to understand this. So if you look at this map of the U.S., with red being the warmer areas and blue being the cooler areas, you could see this is the average temperature for August compared to the entire 20th century. And you can see that the entire middle of the country this August had cooler temperatures than the average, whereas all of those other areas that are in red had warmer temperatures than the average. And you'll notice that Oklahoma is right in that cooler area, and most of you probably saw on television when Senator Inhofe brought a snowball into the Senate to demonstrate that climate change, global warming couldn't be happening because otherwise how could he possibly have a snowball or something, whatever the logic was there. But on the ground, the reality for many people is that they may not be experiencing what we know to be the case, and so that's something that we need to understand. Okay, so an extreme heat event is one that's characterized by weather that's substantially hotter or more humid for a particular location at a particular time. And they occur in all kinds of terrains, rural, suburban, and urban. Why do we say hotter and or more humid? Because the more humid it is, the less likely the sweat will evaporate from the skin. And so people will experience a day that has high humidity and high temperature as even warmer than it really is. Whereas if the humidity is low, sweat evaporates, people are cooled, and they don't experience the heat to the same degree. And who exactly is vulnerable? Well, it turns out that there are specific groups of people who are more vulnerable. The very old and the very young, people who have chronic conditions, heart, pulmonary, renal conditions, or mental health conditions, people who have impaired mobility, if they lack air conditioning, they're on certain medicines, if they're engaged in outdoor activities, or the homeless. Now, as health professionals, we can understand why those groups are at increased risk. The elderly, because elderly people, I'm talking about people of very advanced age, sweat less. They may have less thirst drive. The non-ambulatory may not be able to seek cooler locations or get the hydration that they need. People have cardiopulmonary conditions, then there could be greater circulatory burden, which could push them over the edge. And if they have renal conditions, little dehydration can do the same. People who are on mental health medications may have difficulty with thermoregulation. That's also true for children 0 to 4. They have different thermoregulatory capabilities. And then older children are likely to be outside and running around and put themselves at risk unknowingly. Similarly with sports enthusiasts, laborers who may be placed at risk because they're outside for a greater amount of time, and then folks who are homeless may not recognize the danger or have the resources to cope. So what can we do about heat illness? Well, if it's mild, can hydrate and get away from the heat. If it's more severe, like in heat exhaustion, also hydrate, cool with whatever's available, ice packs or anything else, ice, move to a better location. If heat stroke, then emergency care is required. What exactly are the symptoms? Mild, we're talking about maybe heat rash or fatigue. If we're moving toward heat exhaustion, person's likely to be very thirsty, have a tachycardia, perhaps be weak and dizzy, may experience cramping, headaches, nausea, vomiting, profuse sweating. If they're advancing to heat stroke, they're more likely to be confused, perhaps faint, perhaps comatose or moving toward coma. The skin could be dry as well as moist, and the core rectal temperature will be over 103 to 104. And those people are at risk of mortality. So what can we do to prevent heat injury and mortality? Well, this requires clinical people to be involved and also public health teams. Clinical teams can reach the vulnerable directly. Public health teams can also reach the vulnerable directly and also indirectly. Government has a role, and communication is key. So what is risk communication in this case? Well, clinical teams can identify and warn those who they know to be at risk. They may see them directly or contact them. Practices generally are aware of who their patients are who have cardiopulmonary disease. We call them in for flu shots at the right time of year. Generally know who the elderly are who may be living alone or those who have decreased mobility, and so clinical practices can actually contact these people directly or send out mail or make materials available in whatever ways possible. Mass media can be involved through heat alerts and with awareness of the problem and coordination with government and health weathercasters. Those heat alerts do go out in many areas. Neighborhoods can have buddy systems, block captains, and the public health system working with government and neighborhoods can often create cooling centers or outreach teams. And so these are, all solutions that can be helpful. So this is from healthychildren.org. It's a handout made available by the American Academy of Pediatrics. That's their website, healthychildren.org. And you can download materials to hand out to patients from there. This is an example of a poster that was put together by the Public Health Institute in California. We actually did some public testing of this poster, and it's really meant just to be an example of the kinds of posters which could be very useful in this situation. This shows the urban heat island. Center city, maybe 7 degrees or more warmer than the suburban areas surrounding, and that's because asphalt and concrete absorb heat and then re-emit it slowly. There's less, because the wind is blocked, the cool air can't move around and cool down the city, and then there may be also fewer green cooling spaces. Trees transpire, they actually put moisture into the air, which evaporates, and then that can cool down the air around the trees. So it's not just the shade, which obviously is also a factor, but also that transpiration that makes a difference. And this slide is meant to represent some of the adaptation in areas that are working to make a difference. These slides are actually from Philadelphia, which had about 118 heat deaths in 1993 from a heat wave, and then implemented cooling centers, made announcements over the media, and identified people with block captains and got them to cooling places. This is an example of a handout put together by the Baltimore City Health Department, and it says Code Red Heat Alert Fact Sheet for Caretakers. And this is meant as an educational sheet for people who may be taking care of those who are elderly or have decreased mobility. And then this slide shows the community strategies that can make a difference in saving people from extreme heat events. And so in the middle there, you've got a green roof, which keeps a building cooler. The lower right are white roofs, which reflect the heat back into the atmosphere and can also make buildings cooler. In the upper right shows a body of water, and bodies of water generally maintain their temperature, and so if people can spend time around the bodies of water, there are places to sit, places to walk, those are places that they can be during the day, which are generally cooler. And then on the left there, above and the middle and lower left, are examples of green spaces in the city that will transpire, that will cool things down, and will provide shade for people. So this is a booklet that is offered by the CDC. It's at the CDC website, Climate Change and Extreme Heat Events. It has a great deal of useful information, and if you want something else to use as a reference, I highly recommend this. So to bring adaptation and mitigation together, we need policy change. We need to reduce carbon dioxide output into the atmosphere. We need to decrease burning of fossil fuels, increase renewables, and you'll hear a lot more about that this afternoon. So thank you very much for listening, and we'll turn this over to the next speaker.